Oh, and there he is.
I'll give it just a couple minutes and then we can get started. So I guess we can go ahead and get started. Well, good afternoon, everyone. My name is Bob Dorsey. I'm the Chief of Staff here at the Department of Small and Local Business Development. And on behalf of Director Suggs Evans, I would like to thank those who were able to join us today for taking time out. I think the point of today's discussion is really based on some core principles that Director Suggs Evans is really focused on, as well as our sister agencies, which is efficiency, transparency, and responsiveness. And part of today's discussion in terms of being efficient and transparent is ensuring that we work together as government across agencies to impart information onto our local businesses so that you all are equipped with the tools that you need to contract with the district government. And part of the responsiveness is that in listening to the minimum insurance standards that are going to be presented to you today, let us know as a government if you have any concerns, if you have any questions or feedback, either on the minimum insurance standards limits or based on your personal experiences in dealing with insurance requirements for district contracting. So today is really about collaboration. We'd love to hear your feedback again, and we look forward to working with you going forward. And I'd like to thank our sister agencies, the Office of Risk Management and the Office of Contracting and Procurement, for being on the call today. So I will turn it over to Robert Preston at ORM.
Thank you, Bob. Appreciate it. Good afternoon, everybody. I also want to echo the thanks to DSLBD for pulling together this week's sessions to talk about the minimum insurance standards. Again, I also want to thank our partners at Office of Contracting Procurement, so OCP, and Department of Insurance, Securities and Banking, DSB, for their collaboration on this. This is the last of this week's sessions, and so this is kind of a catch-all, if you will. So during the presentation, if you'd like to put in the industry that you're working in or the types of scopes you work on, please feel free to put that in the chat so I can be a little more specific in terms of the minimum insurance standards. But as Bob said, regardless, we would love to hear your feedback on your experience with obtaining or not being able to obtain the insurance requirements that are in the solicitations, and perhaps, and more importantly, provide some solutions or ideas that you have for your business and your industry in obtaining those. Without further ado, then let me get started with the agenda. So we're going to talk a little. I'm going to go over the goal and objectives for today, and then some background information. How did we get here? Minimum insurance standards. We can have that discussion, and then next steps as we envision it here at DC Government, and then questions and discussion. So, but throughout the presentation, which is very short because the point really is to hear from you all. Please raise your hand by the Teams tool And if that doesn't work, then we'll just have a conversation at the end of the presentation. So the goal is really to support CBEs to meet insurance requirements in district government contracting. How are we going to get there? So one of the ways certainly is to understand the CBE's challenges with meeting those insurance requirements in district government contracts. I've been with the district for about over 8 years now in the insurance division here at the Office of Service Management. My name is, again, Robert Preston. I'm the insurance program administrator here. And throughout that time, we've certainly been engaged with CBEs through presentations, trainings, etc., and have heard the challenges, which have only increased since the pandemic, and we're fully aware of that. But this is an opportunity that we want to provide, again, as Bob said, to hear more about your challenges with meeting those insurance requirements, and have maybe some ideas to what you think we could do to improve that. Provide education and resources. So we definitely want to do that as we gather everybody's input to develop further what we had in mind, and add your ideas to that. And then promote transparency and consistency. And so we'll go ahead and publish those minimum insurance standards that we have put together for various types of industries. So how do we get here? Well, the district, one of the things the district is really looking at is to make contracting easier through transparency. We would like to hear those obstacles, as I mentioned earlier, based on your experiences for contracting with the district in terms of obtaining the insurance for those solicitations. I also want to reiterate that most of the standards, probably like 95% of them, are not new. Nothing's really changed. If anything, some of them have actually been eliminated, or some limits have decreased. So I just want to be upfront about that. It should not be a surprise for those of you who've been contracting with us for a long time. We're just now in the process again of really being more transparent about them by publishing them as minimum standards for all the different types of contracts that are mostly contracted with the district, rather than you seeing them during the solicitation period. And then these are just minimum standards. So again, if you, for some reason, the scope that you're applying to has additional requirements that are not considered as part of minimum kind of scope of work, and considered in when we develop those minimum insurance requirements or standards, then those insurance will change in that section I of the solicitation. So, but these are ones that you should be prepared to have for your industry. Now, I'm not sure if you have an opportunity to either put into the chat your industry, or if you want to raise your hand. I can certainly go over some specific ones. Okay, entertainment, education of children. Okay, professional development. Great. So I'm going to stop sharing for a moment and pull up the ones that we've developed for education related contracts. It's one of the ones I saw in the chat right now. So we'll start with that. So for education, there are a lot of caveats here. There are a lot of footnotes. So I just want to point out that even though this chart has kind of a comprehensive minimum standards, they're going to be tailored to whatever the scope is. But as you can see, the three top ones are standard ones: general liability, auto, and workers' compensation. The employer's liability goes with workers' compensation. So if you have a car, if you're using a car, that just requires that you have auto insurance. If you're transporting children as part of your contract, there are these additional certification requirements, and the limits of these of this auto liability insurance is higher. Otherwise, it would be like the standard $1 million for auto liability. For excess umbrella, so that's 5 million. For crime, it again depends on whether you're at a location, at one of our locations, or whether you are at your own location. So that will then change the crime requirement. There's a minimum cyber liability requirement. Environmental liability, again, that depends on what it is that you're doing. So that's going to depend on the scope of work, as will the medical professional liability. So here, when we talk about education, we're also talking about nurses, doctors, etc. Professional liability would be for more like consulting kind of education, or teachers, or anything that requires a certification, or for us to rely on some sort of information that you are analyzing for us. And then sexual abuse molestation would be for when you are with participating with vulnerable populations. So education can also mean with minors. If you're with adults, that would not apply unless they fit into a vulnerable population type of group. So whether it's like elderly or physically or mentally challenged individuals. Here, I want to reiterate what the nuances, right? So the insurance requirements of contracts that involve overnight travel will need additional insurance. So if for some reason your educational plan, in this case, requires an overnight travel, there are additional insurance for that. Here are the licensing requirements. If you are transporting minors or vulnerable population, these are some of the terms and conditions that will be part of that contract. And then, as I mentioned before, for theft and for sexual abuse molestation, for contractors, they'll be on site to government facilities, and then those in particular for vulnerable populations. Cleaning and removal services, so that's what the pollution is for, the environmental coverage, and then medical support, such as doctors and nurses at school grounds. They would need medical malpractice insurance, and then, as I mentioned, any professional, whether it's psychologists or some other type of consultants, or people on site or part of the contract, they would need who provide that kind of information and analysis or support, will need to have professional liability insurance. So that's for education in general. Now I know that, also for the summer youth program, the Miriam Berry Summer Youth Program, that's another type of program that would fall somewhat under education as well, although it's a little different because it is a working environment. So some of these insurance will be different. And then I see in here consulting. I guess there's a specific question for that. We do have a consulting insurance requirements here, and then I'll go to get to your question here. Let's see here. All right. So for consulting, yeah, we do have those standard ones, and the question is here: I don't use my personal car for my business. So if you don't use a car at all, and you don't have any employees using a car, then obviously auto doesn't apply. Same thing if you don't have any employees, then you would not be able to get workers' compensation coverage either. So that is something that you need to discuss with the contracting officer during the solicitation period to be clear about those caveats. So that's prior to the solicitation ending. Otherwise, once that's closed, it's going to be difficult to change any requirements, just because we want to be as transparent during the solicitation process as possible. And then then there are the other listed requirements for consulting contracts. any of these can be packaged in a variety of ways. Just make sure you talk to a broker, and you will have and then make sure you ask those questions during the solicitation period. So there are different ways that these requirements can be met, depending on what your insurance program looks like. Let's see here. I'm gonna skip. I'll go to employment staffing in a moment. We do have a staffing set of minimum insurance standards for you. So I'll do that in a moment. But I think there's another question about, if I don't use my personal car for my business, why do I have to have additional insurance? Yeah, as I just mentioned, you don't. Yeah, the DC supply schedule, I know that OCP is working with DC supply schedule, and they will work with them a little more about those requirements, and see how we can be more flexible on that front. So there'll be some education, internal education happening as well in the next few months. So beginning of the next calendar year, you should be able to see a little more, I wouldn't say flexibility, but certainly better understanding in terms of the requirements. Employee staffing. All right. Go there. There we go. All right. So for employee staffing, this is geared towards organizations of employee staffing. So these are the requirements for that. Commercial liability, auto workers comp, which includes employer's liability standard. There is a umbrella limit of 10 million. And then third-party crime, cyber, employment practices liability. So that's, as you know, for when to help you stay in business for in case there's a question about either sexual harassment allegation, or a question about the payments, fair wages, etc. This is also caveats here for medical professional. Obviously, if you do staffing for medical professionals, then that will be included. Same thing if you do for any professional staffing, like architects, for example, or consultants, or anybody who has to do some sort of analysis that it would depend on, could be at a manager level, then we would require errors and omissions, and Social Abuse Molestation would be for those contracts where the staffing occurs in areas of where there are vulnerable population present. I do want to say that we look at insurance kind of in three different ways. One is to make sure that the CBE community stays in business should there be a claim. So for those of you who've experienced a claim, hopefully none of you have, but if you have, you realize that the expenses can rack up really quickly between the legal fees and the required responsiveness that you have to have, etc. It can pull away a lot of your resources, both financially and human resources. And insurance will help with that to help you stay afloat. So they provide those kind of services, and that are included in the coverage generally, particularly the ones and the way we ask your insurance to work. The second approach that we do that we take towards insurance is that we look at insurance to help us be better custodians of taxpayer dollars. So we have some fiduciary responsibility to make sure that we don't spend taxpayer dollars if we don't have to on claims. And so one of the ways we do that is to make sure that the proper insurance is in place. The third way we look at insurance is that we want to make sure that, we kind of rely directly on insurance companies to vet the organizations that do business with us. So during the application process, for those of you who've been through it, are aware that it can be quite extensive with the questions that are asked, the evidence of, for example, standard of operations you have to provide, protocols that need to be in place depending on what coverage, what insurance you're looking for, and that can be quite extensive. And so we kind of rely directly on insurance companies to go through that with you and along with your broker, and to help you become a better business. When I say better, with fewer risks and be able to continue being in operations for a long time. So those are kind of for the industries that I see listed here in the chat. I think somebody may have joined since I started talking. So if you do have an industry specific question about the minimum insurance standards, we might just have a bucket here for you. If you want to put it in the chat or just unmute yourself and let me know. Otherwise, I'll just continue with the couple of slides that are left. I'm really looking for, even at this time, for you to interject with any questions or comments about insurance that you have when contracting with the district, any ideas that you have seen. I am sorry, but I'm not familiar with what is MOBIS.
Hi, can you hear me?
Yes. Hi.
Hi, it's some sort of procurement thing from DC, from OCP. It's basically a lot of consulting, management consulting training, but I know that they have their own insurance, that DC OCP has its own insurance standards for MOBIS. Mission-oriented business integrated services.
Okay. I'm not particularly familiar with that. I mean, we just reviewed some of the consulting minimum standards for those who are doing consulting work. Yeah, so whatever buckets we have are the ones that are going to be published, and so you'll be able to see those minimum insurance standards when they are, which should be hopefully no later than the beginning of the calendar year next year.
And OCP organizes them by those categories that for the DC supply schedule. So MOBIS has one list of insurance requirements, and then all the other categories have different ones.
Okay, thank you. All right, moving on. So next steps as we envision it. So certainly, as I just mentioned, we'll be publishing those minimum insurance standards. We'll provide additional continuing education about insurance based on what we've received in terms of feedback and conversations we've had throughout the years, and particularly in the past few days, and then establish some resources to assist with obtaining the insurance. So I will leave it at that for now. Are there any comments or questions before I go to the final slide about contacts? Any comments about insurance? Do you have any suggestions? There's one question here about does Office of Management have a list of insurance brokers to share with? And that is one of the resources that we're talking with our partner at the Department of Insurance, Securities and Banking. It is in the works. The timing of that is not firm yet, but one of the other things that we're talking about is establishing one place for everybody to go to for their insurance questions when contracting with the district. And so hopefully that will have some of these resources. That's the goal anyway. Is it Lolita? Got a question? If you're talking, you're mute.
Oh yeah, sorry. I'm sorry. I was trying to figure out how to unmute myself. I apologize for that.
It's okay.
Yeah, I was actually typing a question because as an entertainment and education company, we also do like arts integrated programming, where sometimes we'll also have we'll hire other artists or independent contractors. So I just wanted to be clear, because we've been getting a lot of requests from organizations that we work with to provide information about our subcontractors' insurance and whether or not they need to have it separately from us. I believe they do. We know that as far as like general liability and things, but for workers' compensation as well, are they also required to have that? Hopefully that's clear.
Yeah, so let me answer your specific question first, and then go to the general piece of this.
Go
So for workers' compensation, it is the law in the district for any organization that has employees to have workers' compensation coverage. So for that perspective.
Oh, I'm sorry. This is we only hire independent contractors, not employees.
Okay, so are you talking about your organization or your subcontractors?
No, our organization. Yeah, our organization. We also are independent contractors, an LLC. But many times, if we get a gig we're hiring other artists or musicians, and then in other cases, we might be doing a residency or a series of workshops where we may hire other people to offer their expertise or subject matter. So we've been also hiring them as a subcontractor. So as it pertains mostly to subcontractors.
Yeah, so as I mentioned earlier, also with the automobile situation, if you don't have a car, you don't need auto insurance, right? If you're not using a car in any aspect of the contract, and the same thing with workers' compensation. So if there are no employee, if your organization or your subcontractors do not have any employees, then they're not required to have workers' compensation. It's just not possible to get, and there's no reason to have it. 1099s would be contractors, and they would have to have the other pieces. But if they're not if they're not employees or W-2s, if you will, then there's no workers' compensation required. In terms of
Robert,
Robert,
just real fast. Generally, even an LLC still needs to get workers' compensation. If you have one, or it's generally if you have two employees. So there are two people who run your organization. You and somebody else compensation. So that's just generally it. If you really are one person by yourself and every single other person is a 1099, then that's a little bit of a maybe, but just wanted to make sure that was very clear. Thank you.
Yeah, thank you.
Thank you for that. Yeah, I appreciate, and we have workers' comp because there are two of us. We've just been getting requests from different clients now that they want to ensure that our subcontractors also have workers' comp. So that was all. So
she's gonna be on the 7th floor for the rest of the day.
The way the insurance requirements are stated right now is that just mute the person. That the subcontractors have to have the same insurance in place as the primary contractor, and so ultimately we'll leave it up though to the contractor that contracts with the District of Columbia to review that requirement and make sure it's in place and to mitigate that risk with its subcontractors, because ultimately we're not party to the it's legal here to the subcontractors. So we leave the operations of the business up to you in this instance. So if there were a claim or there's some negligent act on your subcontractors, then we would certainly try your insurance, and then we also ask for a waiver of subrogation, which means that we could also then go after your subcontractors. And again, we want to make sure everybody stays in business, and so that's why we ask for that insurance to be in place.
Okay, thank you very much. Appreciate it.
Yeah, you're welcome. And yeah, if you have more workers' comp questions, the Department of Employment Services has on their website, so it's does.dc.gov. They have an FAQ and other things about workers' comp in the district, but it sounds like you already have it. So, but if your subcontractors have questions, they can go there too. see here. Yeah, so that there's a question here about being compliant with insurance requirements prior to award and winning it. So there's a couple things on that front. So certainly, if there's this, you should be talking with your insurance broker at least on an annual basis, if not more often, to talk about your business operations and to then determine what insurance you need for your regular day-to-day operations. Now, part of that conversation should be, from our perspective, what solicitations and contracts you're planning on taking on or bidding for throughout that year. And generally, what would, from that business perspective, what would the insurance be? And part of what we're trying to do here by publishing these in advance, that you'll have an idea before the solicitation's even out, what at least the minimums that we're looking for. So once the solicitation's out, you'll see those insurance requirements definitively for that particular solicitation. And the expectation is that once the contract is awarded, then you will have to be compliant with the insurance requirements. I know it sounds difficult, particularly for those who are like on the DC supply schedule and then don't get task orders till later, and the insurance that we're requiring is not necessarily something that you as a business have on a day-to-day basis. And so we have noted that challenge. We do talk with our brokers on a weekly, monthly, quarterly basis, depending on which broker, and we constantly have the conversations about the types of insurance that are available, what the pricing looks like, what the access looks like, what would be the cost of a claim for these various types of scenarios and risks. So, we're constantly evaluating that and looking at those, and certainly taking in consideration the CBE community when we have those discussions, and then establishing those minimum insurance standards. So ultimately, right now, there's no particular solution. The contracting law pretty much, and the process, I should say, right now is that you have to be compliant with the insurance at the time of award. But again, we're looking at that as well and see, what there can be done in that direction. Are there any other questions or comments? Yes, Devin.
Okay. Look, I know that this is generally focusing with CBEs. I am the DC director for the teaching artists of the Mid-Atlantic, and a lot of the teaching artists who are just individual artists, they don't have businesses. Many of them haven't gone through the process of even getting LLCs. One of the arts organizations is requesting each of them to get workers' compensation insurance, which makes no sense to many of us. You kind of touched on it a little bit earlier when you talked about Lolita, but how would you respond to that? Or is there another number I can call to have that addressed?
Yeah, so we definitely noted that. We're going to have some internal education around that. Some more bottom line is if you're, if you're self-employed or, and you don't have any employees as part of your organization, whether LLC or otherwise, then you are not required to have workers' compensation. And it's just not possible to get on top of that. So if you have specific questions about a solicitation as an issue, then actually it's a good segue into this contact session slide. Please contact, the contracting officer for the specific solicitation and have that conversation certainly during the solicitation period, because it's going to be difficult afterwards to reopen that. If you have general contracting questions, please contact the Procurement Center for Excellence that the Office of Contracting Procurement has established for general contracting insurance questions. So nothing specific to a solicitation. Feel free to contact us at the Office of Risk Management. And then for general insurance questions, somebody put in the chat about brokers. Also, if there's educational questions about different types of insurance, the Department of Insurance, Securities and Banking is available for those kind of questions. I didn't list the Department of Licensing and Consumer Protection because they do licensing for your business. So if you do just work in the district, regardless of whether you contract with the district government or not, there are some insurance requirements that they have established. Those are different and less, quite frankly. There's few of them with lower limits because it's not the same as contracting with the district. So just wanted to point that out, and that's why they're also not listed here. It's a different conversation, and it's not one that we're having here today. There's a question here about what constitutes the need for excess liability versus commercial general liability. So let me just pull up. I don't have it here. So there is what we call excess/umbrella requirement. An umbrella covers a variety of insurance underneath. So, for example, if there's a $1 million general liability requirement, a $1 million auto requirement, a $500,000 workers' comp requirement, then an umbrella coverage sits over all three of these. So once you've exhausted, for example, the $1 million in general liability, the umbrella then picks up that excess. It's a way for us to require those additional limits that we feel comfortable with that you have in place should there be a claim to make sure that you get through that claim financially rather than us raising the primary limits to the levels that would be included in the umbrella limit. Generally, umbrellas are less expensive. It's gotten a little tougher these days to get an umbrella coverage, and we realize that. But that's what an umbrella coverage is. And excess coverage would be things like cyber, for example, professional, where you don't have an umbrella that covers it. Right now, the insurance markets don't really allow for that to be covered by umbrellas. So we ask for excess coverage. So it's kind of like a tower, a layered kind of approach in insurance. And that's why, going back to my earlier comments, there are many different ways to package, put together an insurance program for your business. And that's why it's also very important to have a good broker who understands your business, who has access to a variety of insurance companies. So that way you're able to put all that together in a comprehensive way that makes sense for your business and also for us and our requirements. Good questions. Anything else? I see a lot of questions about different types of insurance. So you should go ahead and talk with your broker about the various differences on those. Anything else? Just go back to the contact slide. So if you If you have any other questions, I think this chat's going to be open for a little bit. Otherwise, you do have the contact information for DSLBD, so Department of Small and Local Business Development, and then you also have then this contact information here. Appreciate everybody's engagement on this. Oh, there's one more question just popped in. Yes, so perhaps Diana, you joined a little late, but there may be more insurance depending on the scope. So again, these are minimums, and they may be increased depending on what we're asking for in the scope. So at least you know what the minimums are to be prepared for that, but definitely would look out for your solicitation for more specific insurance requirements. Yes, so again, yes, even if you're using your personal car, you are required to have car insurance. So maybe not commercial car insurance, but certainly your personal one. If you are using your personal car for your business, I just encourage you to talk with your broker. And if you don't have a broker, which you should have, speak to your car insurance company, because they will need to know that in case you are driving for reasons that are required by your contract here. Generally, any claims that are associated with kind of these commercial trips, then most likely will be declined. So there is an endorsement you can get onto insurance policy. Okay. Yeah, and if you don't have a car and not using a car, then there's no need to get car insurance. All right. Well, if that's it, then thank you again very much. Thank you, DSLBD, for hosting this, and we wish you good luck with your contracting, and we'll provide that. I think this is going to be uploaded to the DSLBD YouTube channel, and then look out for further education information. Thank you.
Thank you so much, Robert, and thank you everyone for joining today with the great questions.
Thank you. Goodbye.